The NHS has had a year like no other. With the COVID-19 pandemic adding extra strain, nurses and doctors have had to change how they work, using technology to conduct remote appointments and coordinating with local communities to help with the vaccine rollout.
I call the Secretary of State, Matt Hancock, to make a statement. Secretary of State!
But another shake-up is just around the corner.
Mr. Speaker, I come to the House today to set out our white paper on the future of health and care.
In February, the Health Secretary, Matt Hancock, laid out plans for the NHS in a white paper that he said will create a more integrated, more innovative and more responsive system.
It enables greater integration, reduces bureaucracy and supports the way that the NHS and social care work when they work at their best together.
The reforms, which would come into force in 2022, include the development of integrated care systems, which aim to encourage cooperation amongst local health partners
to support the health of their area.
The proposals also include plans to remove bureaucracy by merging 3 different bodies into one NHS England.
For unified national leadership of the NHS, merging 3 bodies that legally oversee the NHS into one as NHS England. NHS
grants
England
the Secretary of State greater powers of intervention.
Independence, but the Secretary of State will be empowered to set direction for the NHS and intervene where necessary.
How will this reorganisation and power grab improve patient care? He didn't mention waiting times in his statement. It's mentioned once in the leaked white paper. So how will he bring waiting lists down? How will he improve cancer survival rates and widen access to mental health care, and by when? How will this reorganisation narrow widening health inequalities, and by when?
So what will all this mean in practice? I've been speaking to Saffron Cordery from NHS providers.
Therefore, are perhaps living in conditions which make them more vulnerable. I think that's the big issue.
And ex-Health Secretary Alan Johnson.
He said when a bedpan falls on the floor in Tredegar, which was his constituency in Wales, it should echo around Whitehall.
Hello, I'm Dermot Murnaghan and welcome to the Sky News Daily Podcast.
Perfect. When do you take up your role as Secretary of State for Health?
Saffron Cordery is the Deputy Chief Executive of NHS Providers. That's an organisation that represents NHS hospitals and mental health, community and ambulance services.
I think what we have seen over the past year is massive ingenuity and innovation from the NHS, and we really want to capture that. I think that the proposals in the white paper, which will turn into legislation later in this year, do capture some of the spirit of that. So they speak to a desire for local organisations to work together more effectively. So hospitals and other health services working much more closely with social care, working much more closely with councils, with housing provision, and looking at the needs of the population and what's going on locally, and then turning that into a set of services that both treat ill health but also encourage health and well-being. So I hate the word holistic, but I'm going to use it because it is really about taking a more holistic approach and looking at what's needed from services in the round. I think it's fair to say that a lot of this was already happening before the pandemic. The pandemic has really put the skates under this, and we saw it in practice on the ground with huge flexibility, the usual boundaries between organisations just melting away, and people asking less permission really to do things, but just kind of being given licence to get on with stuff. Where we need to focus now is the speed at which we see these reforms being implemented. I think it's really important that we formalise a lot of what has happened over the past year and previously, but I also think that with an NHS workforce that is exhausted And frankly, with the national bodies which have been entirely focused on the pandemic, and a government which is also very focused, rightly, on the pandemic, I wonder if we don't just need to take a little breath and think about where we are headed and not run directly towards another round of reorganisation for the NHS. The last lot was in 2012. That might be nearly a decade ago, but it's taken a very long time to implement the reorganisation from last time round.
But from what you've been saying, Saffron, it seems that quite a lot of that reorganisation has taken place. You said holistically. I'll use the phrase organically. Well, it's in the heat of battle, really, isn't it? Does that then just need to be formalised? Roll back some of the previous policies, do some pruning of the extraneous and almost redundant organisations, the bits that just haven't been used and proved that they could be. Well, I suppose that everything could function without them.
It is a really good opportunity to both formalise, as you said, and streamline. I think the bit that we do really need to think about and be careful about how we approach it is the changes that we make to who's accountable for what, who understands how that accountability line really works. The white paper sets out a set of proposals which would become law, assuming that this bill goes through, which does give politicians greater involvement in the NHS. So if you remember the last reforms back in 2012, they took out a lot of the ability of the Secretary of State for Health or the Department for Health and Social Care to actually direct what the NHS did. This is now coming back into play, and in some ways it's an important move because it's right that politicians at the top of the shop actually have the ability to direct what the NHS does. But then on the other hand, it's really, really important that we are able to make sure that we organise the NHS and make decisions about the NHS without too much political interference. So this white paper proposes that the Secretary of State can get involved in things like hospital reconfigurations. Now, we know that they are hugely contentious political issues, that in order to change services locally, you have to go through a lot of planning and local negotiation. And it's very much a case often of persuading local populations that this is what needs to be done, because people get very attached to the bricks and mortar, for example, of a hospital or an A&E department. And what we are concerned about is that in the heat of, say, an election, there may be undue pressure brought to bear on the Secretary of State for Health to intervene in particular areas. So that's one thing that we are worried about.
And there's also, here's the big thought, there also needs to be a pause, doesn't there, for a really fundamental think and discussion about what the NHS is for. Now, it sounds a silly question, a simple question, but as we've seen during the pandemic, it's firefighting. It's dealing with people that are ill, and that's what most people think it is there for. But when the next pandemic comes along in 10 or 20 years' time, wouldn't it be great if the NHS and our general health structures had played a role in making us a more healthy society? Because we've seen, haven't we, just the research has just come out that says those nations that are the least fit and, let's be frank, the fattest, who suffer more obesity, like the UK, have done far, far worse during the pandemic. If the NHS could lead us back into that, let's use the word again, that holistic health path, wouldn't that be a great thing to do? We're not even asking those questions, are we?
No, I think that the big question here, you're right about the fitness of the nation. I think there's another big question here too, which is let's pause, take a step back and think about what the pandemic has shown us about health inequalities as well, because that's the big issue for me. So, people who have access to good quality housing, who are working in jobs where they don't have to travel to their workplace every day, they are the ones who have been less hit by COVID. And typically we know that people who work in frontline jobs beyond the health service often come from poorer backgrounds, have had less access to opportunities, less access to higher paid jobs, for example, and therefore are perhaps living in conditions which make them more vulnerable. I think that's the big issue that we need to tackle. So we know that there has been a massive issue for Black, Asian, minority ethnic groups during this pandemic, and that stems not from their ethnicity, but from the impact of society and structural racism actually on opportunities and access to services.
And what about just another takeaway from the pandemic, they're moving towards the online interactions that have been taking place, some out of necessity and some are frustrating, but a lot of people saying, particularly on the vaccination programs, saying, well, wow, these apps, the websites, just, how simple it is, how straightforward it is. I'm guessing you're going to tell me innovations that we should keep and follow through on.
Absolutely. I think there will be so many people across the span of health services who won't want to see us going back to where we were. But what sits underneath what people are doing is the need to change some of the legal formulation, to remove some of the barriers, just to make it a little bit easier. I think what we've got to be careful about is in doing that we don't actually introduce instead a whole set of new bureaucracies. And how can we make what we're doing at the moment easier? How can we push the whole of the NHS towards this integrated way of working? And how can we make sure that what underpins that is a really effective legal framework? However, I think what we don't want to see is an overcomplication.
Coming up, ex-Health Secretary Alan Johnson gives us his verdict. Alan Johnson served as Secretary of State for Health under Gordon Brown in 2007. I started by asking him about the last major portfolio of NHS reforms, the 2012 Health and Social Care Act, which established clinical commissioning groups to give GPs more power over services in their area, as well as legislation to encourage competition in an attempt to raise standards.
Throughout that election campaign in 2010, all three political parties had promised no more top-down reorganisations of the NHS. And it was horrendous, absolutely horrendous, because it was based on the 1980s privatisation legislation under Mrs. Thatcher, when gas, for instance, had to lose its place as a publicly owned organisation and be exposed to the rigours of competition. Now, to introduce that into an NHS, which was basically all about competition at every level, and to promise no top-down reorganisation, and then to have a top-down reorganisation so big, as David Nicholson, the chief executive of the NHS, famously said, so big you could see it from space, was one political problem for David Cameron. And I think in the years intervening, it's been very much how do we get round those Lansley proposals without having another top-down reorganisation.
Right, so that brings us to what do we need now then? I mean, I could simplify it given what we've just discussed by saying, do we just need to roll back the Lansley reforms to how it was before that, or have things moved on and has the pandemic completely changed the equation, just in terms of the structures?
Well, I think you can sum it up by saying that the NHS needs to cooperate more than it needs to compete. So they've spent years getting round this, and now this legislation, this white paper, just builds on what the NHS have done themselves to get round it. So this is a bottom-up reorganisation rather than a top-down reorganisation. The NHS published their 10-year plan, long-term plan in January 2019, all about integration, all about more integration, which is what the service needs, working together more than working against each other. But they did point out there were some elements that they couldn't work round, that would have to be dealt with by legislation. And that's what we're seeing now in this white paper. Integration, incidentally, as their own plan says, in terms of that triple integration, primary care should be more joined up with specialist care. Physical health should be more joined up with mental health. And the health service in general should be more joined up with adult social care. Those three bits of integration are what's driving this. What the pandemic has done is just reinforce this argument that they need to integrate. I mean, the vaccination program has been such a success because it's played to the NHS's strength. We have one organisation here. And when that one organisation is allowed to get on and do something in an integrated way, it's a huge success.
Thought occurs just while you're mentioning the vaccination programme. I mean, it's huge success. No one can doubt that. You know, we hear so much about the heroics of the frontline staff and everyone lauds them. But do you think we go too far? Because it occurs to me, and, I recently had my vaccine and, what an efficient process it was. The reason it was so efficient was because of I almost daren't say the words, the bureaucrats. I mean, they're going through millions upon millions of records, getting everyone in at the right time, processing them, making sure they're booked in for their second jab. That's bureaucracy. It is important.
It is, yeah. And it's, the NHS is such a vast organisation that the bureaucracy is necessary. I think you hit upon a real point here, because I always, and when I was health secretary, I particularly worried about this idea that you shouldn't have any managers in the NHS. Every penny should be spent on clinicians, and that if you were an NHS manager, you were somehow fraudulently taking money away from patients. I mean, no organisation needs management more than the NHS, and needs qualified, competent managers more than the NHS.
And while we're on the subject of management, what about all the way to the top and back to this white paper? It seems to be reimposing the Secretary of State, or attempting to do that, enhanced powers of direction, the ability to tell the NHS what to do.
As Health Secretary, I see it as my role, sometimes to challenge, but most of all, to support the health and care family in their defining mission of improving the health of the nation and for caring for those most in need.
That's the aspect I worry about. I mean, Nye Bevan famously said in 1948, when, the architect of the NHS, he said, when a bedpan falls on the floor in Tredegar, which was his constituency in Wales, it should echo around Whitehall. That was a lovely way of saying that, listen, it's going to be centralised. It was very much a creature of its time. And a guy called Rudolph Klein, the great historian of the NHS, has said that the story of legislation is various experiments in decentralisation, followed rapidly by a bill to bring everything back to the centre. And Rudolph Klein wrote that 30 years ago. So, and that worries me, because, one thing where I'd agree with on Andrew Lansley and everyone in the NHS is we can no longer have a command and control NHS. On the other hand, you've got a public health issue like fluoridation. I mean, we've known for 100 years that a naturally occurring mineral, fluoride, if you increase it to an optimal level, you'll improve oral health for kids. We know that because we did it in the 60s in Birmingham and Newcastle, and the results are clear to everyone. So in that sense, there's actually a whole thing on fluoride in the white paper. You can see the need for it. And the final point on this, Dermot, if you're looking for the difference between the NHS and social care, we were talking about integrating the two. The problem with adult social care is the postcode lottery. It depends where you live, what service you get. And so people would want adult social care to look more like the NHS, consistent across the country. They wouldn't want the NHS to look more like adult social care. So I think you have to be careful on this centralisation point. On issues like reconfiguration, Secretary of State should keep his nose out of it. But on issues like ensuring there is a consistency across the country, that's very much a Secretary of State responsibility exercised through NHS England, which is, whatever your view is, a vast quango, or the NHS actually being left to run the service properly. And I tend to think it's the latter.
We got in touch with Minister for Health, Edward Argar. He told us that the pandemic sped up the NHS's process of evolution, making it the right moment to capture that innovation. He also said that the Health and Care White Paper sets out the next steps in building a less bureaucratic, more accountable and more integrated system, reflecting what the NHS itself is asking for, with an emphasis on delivering high-quality care, meeting 21st century challenges and making it easier to prioritise prevention and integration. Thank you for listening to the Sky News Daily Podcast with me, Dermot Manahan. This episode was produced by Lauren Pinkney and our interviews producer, Tatiana Alderson.